Well, hi everybody and welcome. My name is Neil Seidman and I'm the co-chair of the Public Education Committee for ADAA. That's the Anxiety and Depression Association of America. And we're really excited to present tonight's webinar, The Anxiety and Depression Trap in Teenagers. And our presenter is Dr. Marie Albano. We're going to be recording the webinar, so you'll have a chance to see it again at a later time on the ADAA website. Now, during the webinar, you can type in your questions. If you look on the right side of your screen, you should see a Q&A panel, and there's a little field at the bottom of that panel. When you click in it, you can type in your question. Then either hit your enter key or just click the icon. And we're going to try to get to as many of your questions as we can. We're going to have a question and answer period at the end, but Dr. Albano might be able to take some questions as she goes along. And also keep in mind other participants in the webinar cannot see your question. Just myself and Dr. Albano can see your question. Now, before we begin, I just want to say a little bit about ADAA, the Anxiety and Depression Association of America. ADAA was started back in 1979, and today it's the leading nonprofit organization in the field of anxiety disorders and depression. And our mission is to improve diagnosis and to promote the prevention, treatment, and cure of anxiety, depression, and stress-related disorders through education like this webinar, through professional practice and research. We work to end stigma and to get the word out that these conditions are real, they're serious, and they're treatable. I want to invite you to visit the ADAA website. It's a wonderful resource. It's adaa.org. One of the resources that you might want to take a look at is a section called Find a Therapist. And there's just a wealth of information. It's really worth exploring. And also, keep in mind, you can support ADAA by making a charitable donation on the website. Okay, so I'm really happy to introduce our presenter. Dr. Marie Albano is the director of the Columbia University Clinic for Anxiety and Related Disorders, which is part of the Columbia University School of Medicine. She's also the author of a wonderful self-help book called You and Your Anxious Child, which is published by Avery Press. So let me turn it over now to Dr. Albano.
Thank you so much, Neil. And I want to thank everybody for being with us today. It's really a pleasure to be here and to be meeting you all online. And let me just see, here we go. I'm going to talk about the anxiety and depression trap in teenagers, and I'm actually talking to you from a hotel room in Chicago where I attended today a meeting of the Society for the Study of Emerging Adulthood. So this topic is timely because today I sat and listened to all that happens in the aftermath of not getting on top of anxiety and depression that's occurring in teens. And it sort of reinforced what I was going to be talking about tonight. So I just want to put disclosures of where some of my funding comes from. But the overview of what we'll talk about is anxiety and depression, where it all begins. A main focus of the work that I do and I want to bring to the treatments that we are disseminating and that people are doing in the field is that interaction of anxiety and mood issues with development. Because development is something that I think we've not paid good attention to, and so I want to bring that to the forefront. And then how keeping development in mind should really inform our new treatment models and why it's so important at this age group that parents really be important and play a big part in the treatment process. So with that, let's start at the beginning. And I'm fine with sending, for you all to send questions as we move along. I'll try to multitask here and answer and incorporate as many as I can as we move along here. But we'll also talk at the end, as Neil said. So developmental keys. I mean, what we know about development in children, first of all, and especially with teenagers, emotional changes are expected and normal. I mean, we all talk about our moody teenagers, the way that teenagers can be up one day, down the next, anxious about things that parents think are silly, not anxious about things that parents wish they would worry about. Well, emotional changes sort of define that age of adolescence, roughly the 12 or 13 years olds all the way through really to 21. At the same time that there are expected emotional changes, cognitive maturation is occurring. And cognitive maturation, and we'll talk more about this as we move along, really sets the stage for the adolescent to start understanding responsibility and where they have it, where they don't have it, and also consequences. What consequences are of shirking responsibilities, not being able to meet responsibilities, being too responsible. They get it. They start to understand this, which then can actually set the stage then in terms of the developmental changes that are happening for them to be more aware of how things can go south, what they could be missing, where they could be disappointing themselves and others, and this could trigger more and more emotional reactions such as anxiety and depression. So development is key in interacting with cognitive and just age-related stages and changes that occur during this age group. There are milestones that adolescents have to meet. And when we think about, actually, if for those of you who are listening who have children, you think about taking your kids or when you would take them to pediatricians as they were young and developing, you'd be asked about, are they walking, are they talking, are they sitting up, tying their own shoes, how many words they have, and so forth. Well, these are all early developmental milestones. If you really think back, for the most part, we stop thinking about milestones pretty much when our children enter elementary school, and they are tying their own shoes or Velcroing them now, and taking off on their own more in terms of being able to get dressed and meet their basic little needs. We don't ask much about milestones after that point. But in fact, milestones occur, have to occur through the course of development. And when it comes to adolescence, between the ages of really 14 to 21, there are big milestones that they have to take on. And this is just, some of them, first and foremost, through the adolescent years, they have to become emotionally independent from their parents. They have to move from the parents helping to soothe them, solve problems for them that involved other people or when they get upset, and start doing these things on their own to the point where they are doing it all on their own. They need to develop a self-identity and an affirmative one of this is who I am. And we know that this is a struggle and is a struggle for many people for quite a period of time, well into the 20s, but it is one of those milestones that has to occur to become an emerging and then a full adult. We also see through adolescence behavioral independence needs to occur. Take initiative on your own, complete tasks on your own, advocate and be assertive to meet your needs. And this has to happen, again, separately from what things that the parents used to do for the kids. They need to be taking this on more and more. Managing money responsibly, okay, so maybe some of us didn't do this until late into the 30s, but it is something that needs to start being on the table for adolescents, and definitely by the time they hit college, they need to be managing this quite often. Make and keep long-term relationships with friends, and again, the arranging play dates that occurs in childhood needs to end because the teenagers need to do this on their own. And then one of the biggest struggles we know with parents and teenagers is the issue of personal care. And teenagers need to be able to know and get themselves to sleep, know how to do it and put themselves to sleep and get enough sleep. And 8 hours we know is what they need, minimum. Take care of their own health issues, exercise right, or at least get some physical exercise, dieting in a healthy way, and meaning having a good diet, and be able to self-soothe. Now, on top of these milestones, let's add in it's a period of time where they need to develop their sexual identity and really understand who they are in this way. Form romantic relationships through dating and then into serious relationships. Formulate their long-term vocational goals. Does it include college or going into the workforce or vocational training in some way? And this means completing their educational requirements. And then eventually, towards the end of adolescence and into adulthood, they're establishing their financial independence and living independently. Now, think about this. They only have a small window of opportunity really between 14 and the mid to late 20s to achieve these milestones. And if we went back to the first slide on milestones, most of them we have to do before we head out the door for college, and certainly by the time we finish college. So these teenage years are very important for getting on top of milestones that need to be met, struggled with, and then move through during the course of the teenage adolescent years. And so doesn't it make sense that anxiety and mood issues are going to increase during this period of time? Because running around and being a happy-go-lucky child has sort of ended. Now there's responsibility on you, and at the same time everybody's looking at you, evaluating you, and wondering, what are you doing, why are you doing things, and you have to respond to all of this from the environment around you, plus within yourself. So anxiety and mood are increasing because this is a time, too, when just biologically and cognitively there are changes in the brain and nervous system, and so complex social cognitive skills are developing, and the brain is really pruning itself. Connections are being made synaptically and such. So all these skills are able to take hold. Kids can look around the world, see where they fit in relation to others, and using social comparison skills, understand what they look like to others. This naturally increases anxiety when you think that you're looking foolish in front of others, or you're not keeping up with the other kids and what they must think of you, and so forth. Anxiety is going to increase. Couple this at the same time with the fact that in the teenage years, you're moving away from the family being the center of where you get your reinforcement and approval, and it's now more into the peer group. And peer group acceptance and approval, some recognition from a peer group, this becomes quite important, and anxiety and mood problems will be manifest if there isn't affiliation with a peer group, or if the peer group is negative or perceived as negative towards the individual. While all that's happening, academic demands are increasing. We're expecting these kids in the teenage years to be taking on more and more work. Their level of productivity and the quality of their work is expected to be much higher and better than what it was, and we're expecting them to do it more independently. So that is something that also can increase anxiety and also increase feelings of dysphoria. And then couple all of this together with the fact that we want them to do this independently. This is expected with much greater frequency, that they are going to be taking on things and their parents and others are backing out. So they have to become their own, again, advocates and deal with and learn how to ask for help when it's needed and so forth. You can put all this then also in the context of biology, that at the same time all of these things are happening, there's a puberty by environment interaction that may also be going on, and work by Chris Hayward and others has shown that for some teenagers who are advanced pubertally as compared to their peers, they tend to manifest more anxiety and probably mood issues. But that may be biological, but it also may be a function of the environment, just looks at them and treats them differently because they are more advanced. But these are reasons that go into the whole mix of why during this phase of life all these things are happening, it seems natural that anxiety and mood would increase at this time. Now, that's fine, but at what point does anxiety issues or mood-related, do mood-related issues become problematic and warrant some form of intervention or at least some kind of help for the teen? And here is where, we get questions from parents. How do I know this is more than moodiness? Or how do I know this is not just an anxiety phase that he's going through? Well, of course, the number one thing we look for is behavioral avoidance or withdrawal. Avoidance in the face of anxiety, escaping and avoiding events, situations where you might be the focus of attention, where you have to separate from your parents and act independently, or you're trying to avoid things that cause you to be worried and anxious, things that might cause you to have panic. Avoidance is key to understanding the anxiety disorders. It's concomitant in depression is withdrawal. Dropping out of things that would normally be fun for you or that the teen used to do but no longer finds is giving them any reinforcement, or they're not interested anymore, becoming more withdrawn, not talking anymore in the way that they would, pulling themselves into their room rather than socializing with family or friends. The avoidance withdrawal dimension is a big one as a warning sign that there is more to an anxiety issue or a mood issue, and it's not a phase. The next thing, of course, we look at is what's their functioning like. Are they keeping pace with where they were in terms of the way they function academically, the way they take care of themselves, the way they function in the family and with friends, or are they falling behind on these things and falling down? And this is especially an issue if they're not meeting developmental challenges. That is, if they're not meeting the same level of functioning that other kids their age meet. Do they go away on field trips overnight that the school might schedule, or is it a teen who wants to make excuses and not go because they don't like to be away from home? Are they doing their work at the same level that they need to as everyone else, and so forth? Functioning is very important to look for. And then we also take a look at how much distress is the teen evidencing. Are they crying? Are they shaking and showing a lot of upset around key things that are happening, whether it's tests, interviews, parties that might be scheduled, whatever? Are they upset more than they should be about these things? And the upset or the distress that they're experiencing with somatic symptoms and other things, is it sticking and not getting better? And that's where then duration. Do these symptoms, or does this presentation of avoiding, not functioning, being upset and distressed, is this sticking over a period of time? Usually we look at 6 weeks or more, 4 weeks oftentimes when it comes to depression, that they're not functioning and they're getting worse in terms of the way that they are interacting with the world. So these are the key issues to look for when we start to think about, is there a disorder or something budding in that way? Now, what happens as a result of anxiety and mood disorders during this phase of life is it really impairs functioning and it takes kids off the developmental track. They're not keeping pace with peers and they're not keeping good relationship with peers. They wind up suffering. And there's many different reasons for that, from the peers not wanting to be around somebody who always is down or someone who's a worrier, to the fact that they avoid and then these relationships suffer in that way. You might see academic decline, especially when there's school refusal. And school refusal, the old term for it was school phobia. School phobia actually doesn't capture it. School refusal behavior is typically driven by an anxiety or a mood issue where the child, when they're in school, are so consumed with the anxiety or with feeling down, school doesn't satisfy them, doesn't engage them, isn't reinforcing to them. So they do something to try to get out of it, because being there is misery. And of course, once they get out of it and they're at home, they're reinforced with relief, and so staying home becomes the mode that they want to be in. And then it's just a natural thing. By not being in school, academics decline, peer relationships suffer because they're not around their friends. They feel worse about themselves over the longer term. They might feel better in just the immediate sense. But this then goes into the scourge of anxiety and mood issues. Self-esteem plummets. And the kids aren't getting enough interaction with the world to feel that they're effective in any way, so self-efficacy goes out the window at this point. Their independent functioning is limited because parents now start swooping in to do things. Hey, you didn't call the teacher, I'm going to call her for you. You're not doing this, I have to do it for you. And so their independent functioning declines, and it leads to some family struggles. At the same time, the teenager feels terrible but starts saying to themselves, well, I can't do this without my parents doing it, or I'm not good enough to do it, and this solidifies this real negative self-image. This opens the door to comorbidity, because one of the things we've learned from all the work that we've done is when one anxiety disorder sort of puts a crack in the door, another one's going to come and push it open further, and by the longer you suffer with anxiety, then we see mood setting in. And so a lot of times with teenagers that we're working with, 15, 16, 17 years of age, they're not presenting to us with just one diagnosis. They wind up having 3 or more diagnoses. So these things pick up quickly over time. And then the big thing is these kids don't meet those developmental milestones I talked about initially. And so in DSM-4, we had different sections of anxiety and mood disorders. This is the list of them for DSM-5. It looks like a long list. It is a long list. As you can see, separation anxiety, selective mutism, which is now an anxiety disorder, phobias, social anxiety, panic, agoraphobia, generalized anxiety. And then you see for the depressive mood disorders, we have major depression. What used to be dysthymia is persistent depressive disorder, premenstrual dysphoric disorder, the new disruptive mood dysregulation disorder, which has features of oppositionality and impulsivity in terms of upset reactions and mood lability and such, and bipolar disorder. And closely related to these, we don't want to let them go, those of us who are anxiety people, obsessive compulsive disorder and post-traumatic stress disorder. These also will impact kids. So we have to look at and keep our eyes out for these conditions. Moving ahead here, I just want to show this slide to put things in perspective. When it comes to the anxiety disorders, they start early. This is a graphic looking at an epidemiological sample of over 10,000 teenagers between the 12 and 17 years of age who were in the National Comorbidity Survey for Adolescents. Kathleen Marikangas headed this study up. And this shows, the red line shows the onset of the anxiety disorders is early. By the ages of 4, 5, and 6, you see anxiety starts early and it steadily increases all the way through adolescence. The next class of disorder that onsets about 5, 6, 7 years of age are the behavior disorders. That's your ADHD and oppositional defiant, and then it has a peak again, or it increases in adolescence where you see more of the conduct disorder starting in. The green line, or the next to onset, are the mood disorders. These more are disorders of adolescence. Mood disorders coming on more 12, 13, 14 years of age, and peaking there then at 17, 18. And then the last group are the substance use disorders, which we don't see onsetting until 14, 15, really 16 years of age. The point of this slide being anxiety starts early, and anxiety is typically the gateway disorder, especially to the mood disorders later, and their combination will give us then the entree for substance use disorders. And if you do look at teenagers, then again with the National Comorbidity Survey, about 58% of the kids sampled had at least one type of these disorders. They either had mood, anxiety, ADHD, a conduct or ODD type of disorder, or substance use. And what stands out here is about 27% of those kids had an anxiety disorder. That's a whopping percentage of having at least one anxiety disorder, and then you could see mood disorders about 8%, ADHD also 8%. So these are prevalent conditions in teenagers, and conditions to be watched for because they stay with them over the long term. The sad thing then is looking at these kids having these disorders. Well, in actuality, taking a look at whether they get services, only about a third of the teenagers with any mental health disorder at all receive treatment. Can you imagine? So they actually are suffering with all these disorders, these classes of disorders, and only about a third of kids actually get treatment at any course up through their adolescence. And when we look at a breakdown of what treatment who is getting treatment, children with ADHD or teenagers with ADHD are being seen in some way. About 60% just about of teenagers with ADHD are getting some intervention, followed by the conduct, oppositional, defiant kids. But let's take a look. About 37% of teenagers with mood disorders will be receiving some treatment, but anxiety disorders only about 17-18%. So the take-home message here is kids with anxiety do not get treatment. Kids with depression, more of them would need it than was actually presenting in treatment. So largely here in the United States, our kids aren't getting help, okay? And when we also look in the United States at what's going on, we're largely treating our kids with medication. And this slide from Mark Olson and Steve Marcus shows that, over a nearly 10-year span, the increase of using pharmacotherapy alone for treatment in the U.S. and the decrease of psychotherapy or the combination of the two. So the Time magazine still is relevant even, in 2013 here. Are we giving kids too many drugs? Some of us would say probably yes. And that's in light of the fact that we actually have treatments, psychological treatments, that would be effective or very helpful, cognitive behavioral therapy and interpersonal therapy for anxiety and mood issues, medication, and their combination. CBT for anxiety, we know it gives education about the nature of anxiety and what to do in treatment, gives kids skills in managing their physical sensations of anxiety, and it teaches them how to do that, from deep breathing to mindfulness meditation strategies. It goes after changing the way the kids coach themselves and think, encourages proactive behavior by putting kids in situations through the process of exposure to get experience with managing the situations that challenge them, and that extinguishes their anxiety reactions. And then there's a lot of rehearsal so these skills that they acquire stay with them and are generalized to other sites outside of the office. I just want to very quickly just say that we have one large child-adolescent anxiety multimodal study that looked at 488 kids randomized to receive cognitive behavior therapy, medication, the combination, or placebo. And these were kids with separation, social, and GAD. And the results of this study definitively showed us that the combination treatment outperforms everything, but that cognitive behavior therapy alone or medication alone, this is with sertraline, were superior to placebo. The take-home message from the CAM study being that there are effective treatments. It's a matter of getting these treatments out there in the community for kids to have access to. When it comes to depression, there's multi-component cognitive behavior therapy that is effective. Psychoeducation and mood monitoring is very important. And to address the withdrawal from the world and kids dropping out of things that used to be reinforcing, we do what's called activity scheduling and behavioral activation to promote the kids getting back into things that will increase their feelings of self-efficacy and get them out and about with friends and doing things again, which is very important. All of that drives then changing the way they look at the world, so cognitive restructuring is important in there. And then problem solving and doing different forms of family involvement with managing contingencies and such, these and other skills training would be part of a CBT package for depression. Interpersonal therapy uses a lot of work with dealing with problem situations with others and follows a similar course to this. The Treatments for Adolescents with Depression study was the largest trial in the U.S. to be conducted. This was on 439 kids who were 12 to 17. And just to give, let me skip to this next slide, but the response rate, again here, combination therapy was superior, followed by fluvoxamine, a selective serotonin reuptake inhibitor, and then CBT. Now, CBT and placebo were not much different at week 12, but after placebo children or teenagers were not part of the rest of the study, but what we saw is CBT takes longer, but over the course of 36 weeks, the three treatments, combination, medication, and CBT, wound up being equivalent. So it takes longer. The take-home story here is medication works faster. The combination, whether it's anxiety or depression, are going to get the highest result, but these psychosocial treatments like CBT are effective and stick the long term with kids, but they will take a bit longer. But the thing here is, what do kids need in order to really mature and manage what's going on within them as well as outside in the world? They need a lot of skills. And medication treatments aren't going to give that to them, so we really want to push for either the combination or helping them to get into skills-based treatments, which involve problem solving, social skills, and social skills have to become much more complex as they head through adolescence towards emerging adulthood. A big thing is emotion regulation, where teaching teenagers to work with what happens to them when they find themselves in emotional upheavals. And a lot of this is prompted by interpersonal interactions that go south, breakups and friendship issues, arguments with parents and such, and to manage their emotions rather than decompensate into doing something that is impulsive and dramatic, right? We want to work with that with them. Also teach realistic thinking so that they can think their way out of something without being catastrophic about it, and taking perspective to understand not just where you are here and now, but also looking over the longer term in the way that you want to put yourself on a certain path. And then anxiety and stress management skills are always essential for teens. So we think the key skills are self-soothing, delaying gratification and being able to sit with that, and a lot of mindfulness goes into that, regulating emotions, and then plugging in and learning how to increase your positive health behaviors. Now, here's the key, though. We did a study with parents and teenagers who, the teenagers had social anxiety. We asked them to problem solve some tasks that would challenge the teenager with social anxiety, such as finding a place to sit in the cafeteria. There are kids at the table that you sit at. They're all making plans for the weekend. Some of them are popular. What would you do? We asked the parents to problem solve this with their teens. And we also had another, which was you're assigned a speech in a class and how to deal with that. Number one thing, first of all, that we found out is parents dominate the discussion. And if you say to a parent, you know, what is your teenager into? What do they like? Parents usually will say, they don't talk to us. They never talk to us. What we actually found is that they didn't get a chance to talk to the parents. Parents do all the talking. So number one thing this told me in translating to my therapies that I do with teens and parents is teach the parents to step back a second and listen, to be a bit more Socratic, to ask, what do you think? The second thing that we found is that the content of what was being spoken were mainly focused on the blue bar there being non-problem solving statements that were unconstructive. And what do I mean by that? Well, examples of what parents would say in the cafeteria scene would be, why don't you eat as fast as you can and leave because you'll be uncomfortable around those kids? Things like that. The thing here is, I'm not trying to indict parents. Actually, what we thought we saw and what our hypothesis is that the longer parents saw their teenagers struggling with anxiety or mood issues, the more those teens' issues changed the way the parents parented. Parents see problems down the road and they then learn to help their teen avoid those problems. But unfortunately, sometimes that avoidance is something we'd rather the teen wrestle with the problem to learn how to use their skills and learn how to deal with these things. So we think that parent overprotection and over-control is shaped as an interaction between early anxiety and later depression, changing the way the parents would naturally parent the child. And this, unfortunately, gets in the way of the adolescent learning how to manage themselves. Second to that, then, is just bear in mind, if the parents and the teens aren't really communicating well, kids are getting comforted by the internet. And instead, they're going online. They prefer online conversations with other peers who are having issues too. And so we see all kinds of terrible chat rooms we'd rather didn't exist, but they're there. And these are things that work against then teenagers finding healthy ways to really get involved with taking care of themselves. So our developmentally informed model now for treating teenagers is that we know parental overprotection and overcontrol gets involved here, and anxiety and depression are partially maintained by that, but also through escape and avoidance. And this leads to developmental tasks being stalled. So I'm going to skip this slide for a second and just say that we now go for a developmentally informed treatment where we bring the parents in. And we have both anxiety and depression that the teenager needs to take care of in individual treatment focused on them, but also we want to increase independent functioning all the way around by having education sessions with the parents and teen together, coming up with a hierarchy of developmental milestones that we work towards, and at the same time teaching parents to let go. This is an example of a developmental milestone where the teenager will do going away to a college interview on their own, go to the doctors on their own, handle their own checking account, and the rating is whether they are making progress on these goals or not. The transition tasks are agreed to by the parents and the teen with the therapist as to what things they're going to be doing on their own and taking over from what the parent is doing for them. And this are happening at the same time that we're working on reducing anxiety and mood problems by the teenager taking responsibility for that aspect of the treatment. The transition sessions, they're focused on teaching communication and family problem-solving skills and teaching the parents to be effective coaches more in the Socratic questioning kind of approach. Tell me what you think about what's happening. How would you like to see this handled? What do you think you could do? And working more towards the parents helping to facilitate the teenagers taking action. So to focus on effort and think about situations realistically with their teen, asking how to handle this, and give them opportunities to actually do some coping. The most difficult thing we found for parents is they think almost every situation is too big for the teen to handle, that's too big to fail, whether it's advocating for themselves with a teacher or filling out an application on their own. And we have to remove the parental overprotection trap here and help the parents to see they've got to learn. That's okay if they stumble and fall on certain things. That's all right. That's going to teach them how to regroup and what to try differently in a strategy and to learn from mistakes. So managing the parental anxiety is important. We do a lot of work around this for what is it that you're afraid of that's going to happen if you let your teen fly on his or her own, and to be realistic in the way that you look at your teenager and help them move ahead, and also learn how to take care of your own needs and soothe yourself in this situation so you can model coping and calmness for your teenager. And I will end with this last slide that the goal of all of this is launching emerging adults who are healthy, that will enter this age that Jeffrey Jensen Arnett calls emerging adulthood an age of exploration. It's an unstable or an age of instability because kids are finding themselves, but it's also an exciting time feeling a lot of possibilities and hope. With that, we can open it up for questions.
Wonderful. Thank you. While we're waiting for the questions to come in, I have a question. How can a parent help their child with emotional regulation? So the child gets seemingly overwhelmed by emotions that they're experiencing.
That's a great question, and I hear that a lot. And I think the very first thing I would say to the parent is you have to keep breathing. So because, look, as a parent myself, the minute one of the girls comes home upset about something, immediately my fight or flight response goes off, and I have to stop and I have to say, okay, let me keep breathing, let me listen, let's just sit down and start with what's happening. Tell me what's happening. And the first thing you're doing is you're modeling being calm, and you're modeling, okay, let's look at this, what's the problem? And so you're teaching them to soothe themselves a bit with staying focused, start breathing easy, settle down, and now let's define what happened. So now you're going to be modeling for them problem solving. Identify what the problem is that got you upset, and talk about it in as realistic terms and not catastrophic as we can get. So what really happened? How much did that bother you? You can validate how upsetting something may be, because, you know, breakups are upsetting. Getting a bad grade and failing something is upsetting. Whatever it might be, you can validate that. I can understand how that makes you feel so terrible. And give them a chance to vent. And let them vent without judging their venting. Let them vent without jumping in and swooping to do something. Just let them vent for a little bit there, and then, all right, let's think about what is it you want to do. So this is a whole way of approaching their emotional upheavals without swooping in to fix it, but to give them some chance to calm down, a chance to think through, and then help them by talking with them back and forth and listening to come to a way of dealing with the situation, and recognize that what they decide to do might not work to fix or deal with whatever it is, but then there'll be another plan B and a plan C, let's say.
Wonderful. We got a couple of questions about medication. One is if you have any comments about teens wanting to go on medication as like a reaction to peer pressure. So friends have been on meds, and so they want to be on medication. And then the other question is, if my teen goes on medication, which, as you showed in your talk, is the primary treatment that teens get now, if my teen goes on medication, will they be on the medication indefinitely?
So the two things there. One is, if a teenager comes to you, you know, my friends are taking Prozac, my friends are taking Ritalin, whatever, I think I should take it too, I have similar feelings. I think the first thing is to sit down and listen. Tell me what it is that you're concerned about. I can't concentrate, I'm not doing as well as I think I should, I feel I'm jumpy, or whatever it might be, I'm down all the time. Okay, let's talk this. Let me hear how, and what you could do with your teen is take them seriously that they're concerned about something that they feel they're not measuring up to or they're having difficulty with. And I'd make an agreement with them. Let's watch together how you feel over the next couple of weeks. And you could do a very simple mood monitor. Every day, what I'm going to ask you to do is from 0 to 10, 0 being the worst day, 10 being the best. I just want you to put a number on the calendar, and we're going to watch your mood over the next 2 weeks, and then, you know, we'll see how it goes. And if you objectively can see that the teenager is having difficulties, then you'll want to get an evaluation. If the teen isn't, you're not sure, or they're not sure, you might say again, why don't we meet with somebody who is in a position to help you see if this is a problem for you or what things you might be able to do. So I wouldn't sway them and say, no, you can't have medication, because they may be having concerns. I wouldn't jump and say, yes, let's go get you medication, because we don't know if it's something transient, or we don't know that, we're not sure what's going on. The next step would be to get an informed evaluation from a child psychiatrist, adolescent psychiatrist, who could take a look. And you actually might even want to start with a child psychologist or social worker who's schooled in anxiety and depression, just so they can help get a sense of where the teenager is and give them some things to be watchful for. Then the other thing is, how long do they stay on? This is something that has to be a conversation between the parent, the teen, and the treatment provider, because this is a very individual thing based on the severity of illness, the length of the illness that may be there, the multiple ways that different disorders interact. So certainly some people I've seen have been on for a year and some have been on much longer, but it's a very individualized thing that has to go towards where is the functioning and where is the distress and disability, and is medication warranted, and then for the length of time, are we achieving what needs to be achieved to bring this teenager back to a functioning state?
Here's another really great question. What recommendations do you have for books, for workbooks to use with our teen, either before going to therapy or during therapy? Maybe you could say a word or two about your book, too.
Oh, thank you. But I mean, one of the most wonderful things I think about the Internet is your ability to search. And I know ADAA has a self-help book section that you could search on. But there are wonderful, and you'll find there and in other places, there's a whole program of books in the Treatments That Work series by Oxford University Press that has, and I'm a co-editor of the Programs That Work for Children and Adolescents, and they have books for parents as well as for kids that go along with manuals for therapists. There's also, I would look at books by John March, Tamar Chansky. I mean, there's just so many people out there that have wonderful books, Frank Schneier and Edna Foer and others that are written for teenagers that would be helpful in looking at who they are and certain issues, whether it's depression or anxiety. And then my book I wrote, You and Your Anxious Child, Freeing Your Child from Fears and Worries and Creating a Joyful Family Life. I wrote it more for the parents, not just to understand what anxiety is and how to, move your child away from anxiety and develop skills, but also the way anxiety interacts with the whole family and the approaches to help parents to step back, get stable in themselves in terms of their sense of where they are and parenting the child again. So I'd go to the ADAA website as one place to really look for these self-help books.
Great. Oh, we had a question about can people get the slides from the webinar, and the answer is the slides aren't available, but in a fairly short time, the recording of the whole webinar will be available, and you should be getting an email just letting you know where you can find this webinar and then all the other webinars that we've done in this series, and you'll be able to watch them at your leisure, pause them, take notes. Okay, here's another great question. What does a diagnosis, how does a diagnosis of ADD complicate or change a parent's approach to dealing with my teen's anxiety?
Well, how does it complicate or change? We often see children and teenagers who have the combination of anxiety and ADHD. And it's a chicken and egg thing in terms of what came first. I'm not as interested in that necessarily because the past is over. I'm going to look at, in the here and now, what are the strategies that will be most effective and resonate best with this teenager for managing both of these conditions. And so with a teenager with ADHD, I'm going to put organizational skills and help with organization and making things as simplified as I can so there's not confusion and there's also not a lot of stimulation in the environment. So I'm going to ask the parents to work on finding where and when can the house be quiet and a space be set aside for him to do his work. So you're going to look at strategies that are effective for ADHD, and quite frankly, they're going to be helpful for the anxiety too. And then I'm going to be teaching mindfulness. I'm going to be teaching ways of soothing and calming oneself, and then also some rational problem solving for the anxiety that will also help with the ADHD. So many of the skills that we'll do in CBT are going to work for both ADHD and anxiety, and synergistically that I think will get more bang for the buck, and the parent and the teenager will be much happier and working better together, and also the teen moving forward.
Now here's a very difficult but important question.
This came from Marie Albano, I guess.
How does the parent deal with the teen who is doing one of two things? Either talking about, so a teen that's depressed, either talking about suicide, or, this is both in the same question, or if there actually was a suicide attempt. That's a big, big question.
This is a difficult one, and this is, of course, the most frightening thing for parents. As for the teenagers, and it's something that we see in the public all the time now, unfortunately, because episodes, especially following bullying, of kids who have suicided they're viral and on the internet and such. So it is a very scary thing, and I think first and foremost is that the parent and the teen, absolutely the parent shouldn't be dealing with this on their own. And so you've got to go to someone who you can have confidence in, who could be helpful to you. Referrals through your pediatrician or family doc, to a psychiatrist or psychologist who can work with you and the teen, especially because the teenager there, if they've been suicidal, have expressed suicidal ideation, we need to understand, what this is, what prompts it, what triggers it, and then what skills does the teen have available for managing their emotions. Now, the thing we know is that suicidal ideation in teenagers is not uncommon, and that teens who do not act upon it and do not become more suicidal have suicidal ideas at various times. So this is something that happens, suicidal ideas. But we also know that it's the third leading cause of death amongst teenagers, so we want to take seriously those kids who are struggling. So I would say that the number one thing is getting a resource in place who can be working with the family. And the second thing is to work with your teen to stay connected to healthy social supports. Somebody, a mentor or someone at school, the peers who are more of the supportive, positive peers, and then connectedness at home. Not in a way that you want to be over, helicoptering, because that will cause more anxiety and maybe reactivity, but more in a healthy way. And here's where maybe family therapy to be helpful with some sessions so that everybody can be on the same page. And you want a safety plan in place that your doc will work with you on.
What's a safety plan?
A safety plan is an agreement that the clinician, the parent, and the teen will work out when you're feeling suicidal or you have ideas like this, what are you going to do? And it is a step-by-step. The first thing I'm going to do is I'm going to come out of my room and I'm going to sit with people. Whether I'm at home, I'll sit with mom and dad, or I'll go into the cafeteria and hang with my friends. So I'm going to be connected to people. Second thing will be I'm going to talk to somebody who I can trust about how I'm feeling. It gives you a list of things, including who to call, 911 or the doctor's number. It's going to have all of that on there.
And this is a plan for both the teen and the parent?
Yes, it is. And we, depending upon the level of suicide ideation and whether there's been attempts or cutting, whether it's non-suicidal self-injury, which is cutting that isn't meant to, cause suicide, but it's any of this, we have the parents keep a copy of the plan. We have the teenager keep a copy of the plan. It is put in a place in the house where they see it. Now, that takes into account if there are other kids in the house. Of course, it's not going to be displayed on the refrigerator, but it's sure going to be available because we want it to be something that everybody is actively aware of and can turn to when something hits, because when confusion and upset gets in the play, then plans go out the window. So we write it down, we make copies, everybody's got it, and we try to follow by it. I even have put it into like the notes of smartphones and stuff for kids so that they have it right there in their phone.
So this is something that the parent and the teen would work with the mental health professional to develop?
Yes.
Okay, great. And I hear, boy, you're getting such wonderful questions. Thank you, everybody. Here's a great question. This has to do with prevention. What are some things to look for with my child to prevent anxiety disorder in the future? And I'm wondering if this question relates to what you talked about, parents tending to want to be overprotective of their kids when their kids are struggling.
Well, this is an interesting question. That's a great question, because the question is, how can I prevent an anxiety disorder in the future? What do I need to recognize to do that? And so this is interesting because, anxiety is a normal emotion, and it is something that temperament, genetics, the biological wiring of individual nervous systems, and then the psychological makeup of the way the child has been in the world from the time they're tinies and interpreting the world. All of this goes into play. The family environment, the school environment, the community, everything goes into play for shaping whether there's risk for anxiety and then whether it's realized. So I think one of the things that parents can do is, along the lines of the conversations with your children, be talking with them openly, identify with them how what's going on, trying to keep conversations going, make opportunities for them to be engaged in the world. And when you see them slinking away and shying away and avoiding, address that. You turn down those invitations for the party that all the kids in your class are going to. Tell me what's going on. And address some of the things that the kids are saying with, questions. What do you mean everybody does drugs? There's 400 kids in your class. Is everyone on drugs? Tell me what is it that you're concerned about? Let's talk about that. Do you have someone to go with? Who can you think about asking? To work them through in a Socratic way to help promote their engagement as opposed to shrinking away, because that's what trips kids up. When they avoid, anxiety takes hold. So I'll leave you with that, but that's the big thing, is keeping kids engaged as opposed to letting them escape. That's going to help prevent anxiety.
Great answer. Well, we're sorry we can't get to all the questions. We hope that our website can help address questions, and just go to adaa.org and see if you can find some resources that could be helpful. And Dr. Albano, I just want to thank you so much. Fabulous presentation. And I want to thank everybody for attending. As I said before, you should be getting an email letting you know when the recording will be available, so you can view it again and tell people about it. And please let friends and family know about the webinar series. And finally, consider making a contribution to ADAA so that we can continue these kinds of programs. So bye for now, and we'll see you next time.
Thank you all.